Hi, everybody. We are going to do a couple in-house technical things and
making sure we have.
Yep. Oh, yep.
And I'll run downstairs.
Okay. Hi, everybody. We are going to do a couple in-house technical things.
Oh, making sure we have. Well, now we know the sounds.
Okay. I'm going to run down and make sure we've got a solid signal downstairs, and then we will get going.
Okay.
All right. Yeah, last time.
Like the sound is working. Yeah, we really. Oh, let's turn the camera this way a little bit.
Okay.
Because we recorded the video and then come to find out that our sound wasn't working.
Yeah, the audio stream didn't work.
Yeah, so please let us know, if the sound doesn't work or anything's not
yes, and if you have
right.
If you have any questions, just type them in the chat comment window. But what we're going to cover here real quick, let me make sure I have everything. All right. Yeah, we're good. And again, we're about 5 seconds behind real time, so I'm talking to a camera and can't tell, if you can see this or not. Hopefully it's good.
And thank you for joining us.
Yes.
And please smash that like button. You're probably here because you or a loved one has had either sports, been sore from sports or had back, concerns. And, please show your support, and we're so happy to have you here with us today. I'm Dr. Wendy McHugh. I'm not a practicing doctor, but have a
medical doctor.
Yeah, not a medical doctor, and co-founder of Women Couples Wellness.
Yes, and I'm Steve McHugh, and I also have a doctorate in human sexuality, focusing on clinical sexology. But I also have a pretty in-depth background in neuroscience research and a few other things. Plus, I've been involved in martial arts most of my life and had a lot of injuries, so I know what chronic pain is like. But what we're going to talk about today...
And ways to minimize it.
Yes, yes. What we're going to cover today is using the high massager for sports massage or recovery massage, focusing on the back. And we're going to cover how to do it to yourself as well as how to do it with a partner. We're first going to go over what high is and the benefits of it and how it compares to other products out there, and then the approach that we use for this. Now, one thing that we always want to emphasize is this is not medical advice. This is not any type of therapy advice. We're just showing you some practical ways or skills that you can apply to help yourself feel better. Now, if you do have any kind of injury, we strongly suggest that you go to your doctor or your chiropractor or physical therapist and work in conjunction with them. And if possible, bring your high unit and show it to them and get their input.
Yes, we encourage you all to share how the high massager has helped you with your doctors and physical therapists. And the more doctors and physical therapists that we get on board, the more the high massager can get out and help people.
Yes, we get...
we've got exciting classes coming up on that.
Yeah, so typically once or twice a week we get an order from somebody who said they actually learned about it through their physical or massage therapist. So it is, particularly in Florida and Texas, a lot of healthcare practitioners are starting to adopt it. But without further ado, would you like a class? We will go
and
over
if you have a high massager, please go ahead and get it out and do the techniques with us. We're going to cover both the self-massage and massaging your partner. If you don't have a high massager, you can go to highmassager.com and purchase the high massager there.
Yes. So let's go here. Hopefully this will show up. Again, we are about 5 seconds behind real time, so I want to make sure that we can actually be seen. I'll move these chairs real quick. As you can tell, this is live, so
yeah.
we're having
way back. You're on candid camera.
we were having a technical glitch a moment ago where it wouldn't connect. And
But the high massager comes in a bag like this, and it comes with different cover heads. And what you do is you connect.
Or you get a power supply.
Yes, a power supply separate.
This works on US and European power. It is DC power coming from here, but the reason we go with a power supply instead of a battery, European connection, is a lot of times you will want to use a massager longer than just the 10 or 20 minutes that a battery-powered one will work. And to have the type of power this thing delivers, it's just not physically possible yet with a battery. Plus, you have to have about 8 of those battery packs.
Yes, because it's much more powerful than the hypervolt.
Well, we can't specifically reference names. But,
yes,
but,
we're not endorsing.
There are therapeutic products out there that as much as twice as much that can't deliver the amount of power this does for the amount of time. And we'll cover using, this is just a generic tool for sports massage. We'll cover this compared to the high and distinguish it here in just a minute. But I'm sorry, as you were saying, to plug it in.
You basically, so this connects together with the power connector, and if you want the European adapter, then you would connect that here instead. So we're using the US attachment, and on the other end, you'll basically stick it in, and then you're going to twist it to lock it in place. And you want to do that before plugging it in, you know, just to be on the safe side when you're, that way it's all connected before plugging it in.
And now one thing we'll show, normally we just plug this in right over here, but if you're using this where you have a massage table or in a location where you need more room, you have about 6 feet, maybe about 7 of distance here, but it also, you can get a extension cable that we have now that is wonderful.
And so many have requested it, whether, you know, it's home use or you're a physical therapist or massage therapist. It really does help to have the longer cord. We've even seen where people will put the cord overhead, almost like a shop, you know, or with the tools hanging overhead and you pull them down.
Yes, and this is a 3-meter cable. It's about 9 feet 8 inches, but it's very similar. You just insert it, twist it to lock it. Then you go to the other side, insert, twist, and lock. And then that gives you a lot more range. When you plug it in, you'll hear a beep in just a moment. Oh, gotta get that plugged in there.
And there's a delay.
Actually, let me make sure the power circuit's on. Oh, we're having all sorts of technical problems today. Hold on just a second. Why didn't that?
Hope you all are having a great week. And if you, you know, did anything interesting, let us know. If you had a sports injury, go ahead and share what it was. You know, was it a back injury or, you know, were you sore somewhere? I know, was it several months ago, Steve was moving several boxes and they were real heavy. And your back was kind of, it felt like it was out of place and just one side was really knotted up. And it was going to be a while before we could get to the chiropractor. So I said, well, why don't we use the high massager?
Part of our protocol.
Yeah. And so we did, and I think every day for about a week, and the muscle relaxed. And of course, we're not giving medical advice, but that's why we're covering, you know, how these massage techniques can be so powerful to help you and your loved ones out.
Yes, we have that power outlet with a little switch I had to turn on. But basically, when you plug it in, you'll hear a beep, and the power supply will turn green. Then you hold the power button down 4 seconds. It'll beep again. That turns red. Now, one thing I want to mention also, these have the high power percussive heads on them. Um, we have the sound reduction heads as well. These are designed for use over clothing, and it's optimized for strength. That works the best for muscle massage, large area massages. If you're working on skin or for women's health applications, sometimes you want to switch to the sound reduction heads, which and those come in the unit. To do that, a lot of people ask, you squeeze this together slightly to pinch it to get a little lip on it. Then you just pull it off. So squeeze, get the lip, pull it off. Then you take the head cover, you turn it inside out.
And it's flexible material, so you're not going to harm it, by turning it inside out, just to let you know.
Yeah, so put that in there. Oops, pull it inside out.
Very high quality silicone, and same with the lower five guide.
And that reduces the sound by about 60%, and it keeps you from potentially getting pinched. Now, for general back massage and sports massage, these are great to go with. But
which would be over the clothes.
Yeah. So I figured we just switch to that though, just to because a lot of people ask us how to use those. Now, as far as what high is, it's got two percussive heads that are at a space that was optimized for the space between a woman's pelvic bone. But it is different from other percussive massagers in the distance that it goes out, the amplitude. This actually, we put a lot of research into this. This is tuned to go as far through tissue as possible based on our experimentation, and we worked on that for about 10 years. So these two heads go from about 4 times per second, 7 steps up to 32 times per second. Long story about why we chose that range. This also will vibrate at 7 steps from about 40 times per second up to about 140 times per second. The Vibe Guide can be used as a handle also to put it behind yourself, and we'll go into the advantages of that for self-massage here in a minute. But combined together, there are many, many, many different things you can do for women's health, for sports massage, couples massage that give you a lot more capabilities than if you just
and men's health too.
Yes, yeah, there are techniques for men's applications as well. Basically, for instance, with the guide, you can hold it behind your neck yourself or behind your back.
Around so they can see.
Oh, yeah, that's a good point.
And it really, working at the computer or texting at your phone, a lot of people will get what's called the programmer's hump. Constantly down like this, and it causes the muscles to tighten and be imbalanced, and the spine can curve and be very painful.
Yes, this, if you were trying to do that yourself, it's not nearly as easy to do, or for the back here.
And it's not symmetrical because with the high, basically you're able to, it's perfectly spaced on each side of the spine. So you can go up and down the spine like this.
Now, that gives a general overview of the differences. But what we're going to cover here today is self-massage techniques, why you would want to do them, and what the goal of doing that is for, and then couples massage techniques. Now, the two areas that we're going to be talking about is if you have just general muscle pain or soreness from just daily stress to help relax your muscles, as well as if you've worked out and you're trying to recover faster. We also, in the self-massage, I'll mention a lot of our other techniques for relaxation, women's health, etc., target this area because the vagus nerve comes out of the cranial the vertebrae on each side and goes down. And that specifically...
starting at the top of the ear.
Yes, it goes out and it has distal branches that go up here, down the sides of the neck. We specifically target that area to help you relax. Now, I'll mention that briefly. But uh, as far as what is going on, again, this is not a medical discussion, but with muscles, particularly in your, the cervical area of your neck, thoracic, lumbar, in
Mm-hmm.
the sacral area down here, many times, um, if a muscle, if this is your spine in the middle, and these are the muscles on each side, normally they support and hold your spine and balance it. Um, if one side is sore and it pulls too much this way, that increases the chance that the vertebrae will slide out of alignment.
Mm-hmm.
Now, again, we're not chiropractors or physical therapists, but they'll tell you the same thing. And that is a very common source of challenges that people will have because one side of the body will become more tense than the other, either from just like you're right-handed and you're left-handed,
Mm-hmm.
the muscle contraction patterns appear to be more dominant on one side. So this technique is wonderful for helping just relax. If you have any kind of muscle imbalance where it's knotted on one side and not on the other, and it's pulling, getting out of alignment, just going up and down here or holding it here or lower can be great for this part of the neck. You can't really reach yourself that readily in the thoracic region, the middle part of the back.
Mm-hmm.
But for the lumbar, you can go down here, and also the two sacral iliac joints. In your pelvis, you've got these two bones here, sacral bones, or the sacral bone here, and then the two iliac on each side. There's a little joint right there, a little piece of cartilage that basically supports the majority of the weight of your body from your spine coming down. And if you have tension in these muscles, it can happen from many, many different things. Or you've just been sitting too long.
They
It
may
can
not be
pull.
able to hear you as well.
Oh, yeah, it can pull. And good point. It can get things out of alignment.
Yeah.
So,
And it does, in sitting a lot, it causes different stress points on the body. And in sports, like Steve mentioned, if you're left or right handed, it can cause extreme injury depending on the degree that you're, practicing or in that sport, and cause imbalances in the body.
yes. And what percussive massage does, there's only more recently been more detailed research on it. It's been used for thousands of years, but the two major areas that it appears to help with is number one, if the muscle is tight and the muscle fibers have contracted together, and you do the percussion on it, that helps them relax and let go. As they relax, you get better circulation, better lymphatic drainage, and just general better recovery. Now, another very interesting thing that happens is if you hit it at the right frequency, and that's one area where we shine with this because we can combine different vibratory patterns.
Mm-hmm.
You can do something called myotactic reflex contraction, which if you go to a doctor's office and they test your reflexes and they hit your elbow and it moves, or they hit your knee,
Mm-hmm.
that's a myotactic reflex where when the tissue was pushed in from a strike, it sends a loop to the spine and back that makes it contract real quick. And that actually happens thousands of times a minute. Just as us standing here, that's keeping our muscles in balance so that we don't fall over. And we don't even think about it. It's very, very subtle.
Mm-hmm.
But certain types of percussion can induce that myotactic reflex. So if it pushes in, it causes the muscle to contract. And that appears in a lot of people to help tone the muscle and increase the muscle strength. So if you are uh, two different scenarios. One, like in our focus with women's health for the pelvic floor, that percussive massage both helps the muscle relax if it's spasmed, increases circulation and lymphatic flow, and then the myotactic reflex contraction actually appears to help build the muscle.
And we'll do a separate video on different techniques to do, to build the muscle with the high massager. But for now, we'll move on to the actual technique because I know
Yes.
you all have been waiting It's probably about 15 minutes in.
That's true.
Um,
I'll show you first the self massage techniques and just go over it, and then Wendy, if you could, I'll do the couples massage on you here.
okay.
So if you've come in and had a long day, or you've been working out and you've got a pain somewhere. Now, first of all, if you do have any severe pain, don't do anything that hurts.
And make sure you check with your doctor, if you're not sure if you can use a percussive massager.
Yeah, and thank you for mentioning that. If you have any type of vascular problems in your legs, deep vein thrombosis, or anything where you can get clotting, particularly in your legs, don't use any type of percussive massage, this or any massager, until you talk to your doctor first. Because we've never seen any challenge with that in the over 10 years we've been doing this, but that's a standard disclaimer that is covered, because there is a very small potential risk for that. So yeah.
So again, if you have a high massager, go ahead and get it out and grab your partner and you can practice on them or they on you.
Okay.
I'll have some water.
Okay. I'll just sit right here so they can see it. So, and this is actually very, very simple, and it's going to seem simplistic, but it's very powerful. The first thing, you turn the massager on.
And you want to hold it down till it turns red and it beeps.
On the left side, if you're looking at it, it's percussion. On the right is vibration. The plus button increases the speed. The minus button decreases the speed. So you grab the vibe guide here, put it at the base of your shoulders, turn it on to whatever feels comfortable.
And we'll use it on the lower level here just so it won't mess with the microphone. But we always recommend to start low and then build up and see how that feels. And if you're giving the massage, which we'll go into when we do the couples massage, make sure, kind of like your massage therapist, that you continually check in and say, how does that feel? Do you want me to increase the speed or decrease the speed? And you also want to kind of think about that when you give your own massage. You don't have to go, full speed ahead on it. Just see how things feel and how your body responds to the different levels.
Yes, and for the neck massage, start at the base of your shoulders and just hold it there. As long as usually
you want to start at the base and hold it there, and then you're going to work your way up. But you do not want to use the high massager directly on the bone.
So just have it up at the spot right below the skull, hold it, and then just go back and forth. And
so you go from right below the skull all the way down to right above the shoulders here. And those are common stress points.
And then after you've done that, you can also take it and gently go back and forth just slightly. And just do that as long as you feel comfortable doing it. You can either hold it at a specific spot or just move it around. After you've done that for a minute or so, then take it, and there's a pressure point in the middle of your shoulder right here, and also on if your spine is here and your shoulder blade's here, it's between your spine and your shoulder blade. If you press, you'll feel right there. That's the spot for me. That'll be more sore. That point is considered an important thing to massage, both in Asian theories, as well as a lot of reflexology and pressure point techniques for massage. So with the high massager, take this percussive head, put it between your shoulder.
And it'll touch both of those key points.
Yes, so your shoulder blade's over here, your spine's there. And if it's easier, you can cross your arm the other way.
And sometimes you might want to use a pillow and just completely relax this arm and let your other arm do all the work. and vice versa when you switch.
Yes, and just hold it there for a minute,
Mm-hmm.
and then you can also move it back and forth slightly. You can move it a little bit. If you want, you can move it over, avoid the bony edge of your shoulder blade, but you can move it right in the middle of the shoulder blade. That is another point that feels really good. Hold it there. Now, if you want, while you've got this, you can also go down your arm. And then once you've done it on this side, switch over to the other, middle of the shoulder.
And again, as you use these techniques on your body, kind of check in with yourself. How does it feel? Do you want to increase the speed? We're having it at the lower setting just to make sure that you can hear everything. Um, but these techniques are very powerful. They touch upon key points that are pressure points. And you'll see how in just a short amount of time you can really relax your whole body.
It really does. It's relaxing me right now because we had a whole host of technical problems starting
yes.
out. So that's that. And then you just move it here. And that is really, really good for relaxing this entire region. Now, the next step, which is very common in, well, men and women, for sitting all day, your lumbar area. If you take the massager, oops, and you have your spine, and reach up as high as where it's comfortable, and just increase it to whatever. I'm going to keep it lower so you can hear me, but just hold it, and believe me, that feels really good.
Oh, let me see if there's some chats up there.
Okay. Here, I can check it out.
Here, I'll show while he's checking the chats.
Does a vibration lumbar 2 and 3? I can't give any medical advice on that, but she's asking, lumbar 2 and 3 for the discs that are bulged. What I would suggest is that you talk to your chiropractor or doctor and make sure that they feel it's okay. But as a rule of thumb, relaxing the muscles around the spine generally is a good thing. Yeah, generally at least. But again, if you have any kind of injury or anything that you're concerned about, I would suggest that you please talk to your doctor first about it to get their approval. But that covers. And I'll just stand here if you
The self massage.
Yeah, you can also do it standing.
Mm-hmm.
Here. I'm not sure how low you can see. Now for the sacral region, which are these two spots right here, you can take the massager and hold it right there. And that actually feels quite good too.
Mm-hmm.
And you can also go down on your rear. And
those are often the key stress points. If you're sitting all day, have a repetitive type of job, or even if you just, sports or, going to the gym and doing too many squats, you can really have very sore area, sore glutes.
yeah, so that feels very, very good, and it's also good for helping relax. I'm assuming you can see me there. Yeah, I think.
Yes.
Again, your sacral region of the sacrum, down here to the tailbone, goes down like that, and you have these two joints that each side of the pelvic bone, the iliac, connects to. If you get tension in these muscles, it'll cause things to misalign, and that can just produce a whole host of problems that you don't want to have to deal with if you can avoid it. But to quickly summarize, the massaging the, if you want to get comfortable there, you for, oh sure. Oh, sorry. For self-massage, for this region of the neck, hold it in its place, move it up and down slowly. Do that as long as you would like. Then you can put the points here, holding it. If you want, you can go down your arms a little bit. On the other side here, and on the arms. Then for the lower back, or if you want to start higher, I don't hurt your arm to reach up too high, but just hold it there and then move it down. And then for the sacral areas around here. And there are other things you can do for full body massage, but that you can do to yourself. But that is a great overall way to help relax your back quite a bit. Now, in the case for having a partner that can help you massage or can help massage, you can massage them. We're going to cover basically the same areas. One thing that I wanted to mention as well, a lot of times if we get tension headaches and people feel tight muscles here, that many times, not always, and you think, oh, if you rub the neck and that feels a little better, but then the headache comes back. A lot of times you'll actually have spasms down here. And there's a whole sheath of connective tissue that goes up your entire back. We're starting by right there. Goes all the way up to here. And if this spasms and pulls down, it'll put extra tension here, making these muscles tight and spasm. And you massage these and it relaxes it, but then it comes back because the actual source is down here. So doing this technique, relaxing this area and going down and relaxing here, or if you want, doing it the opposite way, lower back and up, is a wonderful way to help relax and reduce that challenge. Now, for couples massage, for instance, when I was overly, well, long story, hurt my back last year, Wendy would do this on me every night. And that's another great thing to mention. If you're trying to relax at the end of the day, just doing this to yourself or with your partner, where you take turns every other day, it's a wonderful way to take care of yourself or take care of each other. So we're going to repeat this process with the neck. Now, it is more challenging to massage the neck if the person's laying down, unless, in our case, we actually, I'll move the camera. We have a massage table with a, hopefully that will let you see Wendy's head. Again, we're about 5 seconds
Was
behind.
my head chopped off?
Yeah, let me try to slide. Yeah, I think that'll do it. I hope so. Yeah, it should be fine. Okay, well, almost. Well, that's close enough. If you have a massage table where they can rest their head straight down, that's the best way to do it. If
or a massage chair.
Or massage chair, yes. If the person has to turn their head to the side, don't do the neck massage because it puts things in a weird angle. Although if they're sitting up, and we'll cover that with you sitting up here in a minute, you can do it. But you take the Vibe Guide and turn it out. And again, with couples massage, it's extremely important to talk to your partner and get feedback. So you turn it on the low setting. Does that feel good?
Yeah.
And you just increase it to whatever feels good.
Yeah, that's perfect.
Good. Okay. And also, sometimes if people are sensitive to sound, the sound reduction head covers are better for massaging, the neck, because the normal ones do make more noise. But you just hold it there for a little while, a minute or so, and just let the muscles relax. And then you move it up right to the base of the skull. It's not very far, actually. And then you go back down.
Yeah, that feels amazing.
Okay. And that feels good. So.
Yeah.
And after you've done that for a little while, you can rock it very gently. You do not want to go all the way to where you have percussion on the side of the neck here. Oops, sorry. Here. So again, don't use the percussion on the sides or the front of the neck, just the muscles on the back. After you've done that for a little while, there's the point again on the shoulder, the middle point of the shoulder, and the spot between the shoulder blade and the spine. With that, you go right here. That feel okay?
Yes.
And you just hold it there for a little while. You can move it just gently if you want. Back and forth. And there is a spot, you find the shoulder blade, the kind of fleshy part in the middle of the shoulder blade. There, you just have to be careful with that you don't get on the bony spots. Then for the other point, does that feel okay?
Yeah, that feels really good. I can feel it in my fingers.
And you just hold it there again for a little while. Now, one key thing for the back massage, it depends on the size of the person. Women or smaller framed people, you need to be more, to adjust more for this. But when you start doing the back massage, the shoulder blades here, you need enough space to clear for the percussive heads to clear the edges of the shoulder blades. So if the shoulder blades are close together, what you do is you grab the wide guide, you turn it out, you start at the neck, and then as you go to the shoulder blades, you tilt it slightly this way. So if this was going down the back, you tilt it slightly that way. What that does is it causes the percussive heads to be closer together. Just like that, and then you work your way past the shoulder blades. And now in this, the percussive head is on each side of the spine, and the spine's in the middle, so you're avoiding the spine. Oh, good. And if you can have a partner do this for you, it just feels really, really good. And go all the way down until you get to the bony part of the sacral area, which you want to not go too hard on and just avoid that. And then just work your way back up. Most people will not complain if you spend a lot of time doing this because it feels really, really good.
Like the opposite.
Yeah.
And it's easy to give too.
Yeah, it's compared to the techniques where you have to give a manual massage doing this, it's tremendously easier. The only thing you have to be aware of is take the vibe guide and bend it up. It won't break. Just hold it like that.
So that the points are even on the pad.
Yeah, then get the percussive heads on the same amount of pressure. And what this does is, as I mentioned, inevitably, because we're right-handed and left-handed, one side of the back will be more tense than the other. And that can just be from, daily stress of stuff going on, or, if you're using your dominant arm, you're using that side of the body more. So this helps relax both sides of the muscle. And get them to kind of balance out. Now, if you want, after you've done that for a little while, you can take your arms and just press on each side up to try to help stimulate the circulation. But so what you've done is you've used the percussion to relax everything, and then you just go in stroking motions like that.
I think I heard a little pop.
Oh, good. And if you do see a chiropractor or a physical therapist, go to them and ask them about this, and ask their thoughts. Now, if some chiropractors think you should only get help through them, it just depends on the person. But most of them will think that's a great thing to do, for as long as you go on each side of the spine in the muscular areas. After you've relaxed the back, if you want, you can go on the sides. For some people, this really tickles. Like that tickle.
It feels good.
And you just hold it right there, You can go down just a little bit. You make sure to avoid the hip bone. And then go to the other side. So you're not hitting the spine, you're avoiding the spine, you're just going on each side. And you're not going up to where you'll hit the rib cage up higher, you're just on this area right here. And after you've done that, you can go back to the middle of the back, really focus on that. You have to get their feedback, talk to them. If you go down lower to where the sacral area is, avoid the bony spots, but go to the rear right past that. So you're not hitting the bones, and just hold it there. Now you can do a rear massage. I'll go ahead and cover that. Uh, we're not. It's not the exact topic.
There's a lot of tension points there.
Yes, a key thing, and I've had several friends that use Hive rave about this. Again, we can't make any medical claims here, but a lot of times people will have tension in these muscles, and that pulls that sacral iliac joint kind of down, or it presses it in, which can pinch the sciatic nerve, several things that can cause pressure there.
And so, a lot of pain.
Yes, yeah. Believe me, I've had that. And it comes from things you wouldn't think. I was once pushing a cart at the hardware store that had a bunch of stuff loaded on it, and next day I was hobbling around. So basically, you've relaxed the back, you've relaxed the sides. Avoid the bony part of the sacrum, but go past it to where there's more muscle for your gluteus maximus, if you want to call it, the rear, and just hold it there. Yeah. And usually you can take it up full power. Yeah, that's great. And again, avoid the tailbone, the tailbone right here. Then on each side, does that feel okay? Yes. Men and women love this. And just go up and down. And then on the other side, again, you're avoiding the tailbone here. You're going past it.
It's interesting that side's more sore.
Interesting.
But yeah, if you think about stances in sports, whether it's softball or golf or tennis, you have a repetitive movement in the legs and the arms.
Mm-hmm. So after you've relaxed the rear, you can go back. Now be careful with the hip bone, or well, actually you'll be fine there with that angle. You can go back and massage this front area again. And what I've found is it's good to relax the back, then relax the rear, and then go back and work on the lower back again. Or go all the way up if you want. But doing that routine takes about 5 minutes, maybe 10, depending on how long you use it. But I think you'll find that it really, really helps you relax and feel better. So that's just a wonderful, wonderful thing to do. Now, Wendy, actually, if you sit up and are you okay?
Yeah, I'm asleep. Actually, after the second,
actually, spin around this way.
Oh yeah. After the second one, I was so much more relaxed. Want me to lay on my back?
Actually, if you just sit right here. Now, another thing you can do.
Let me put my chair up.
Yes, please. Yeah, weird. Oh, there it is. There we go. Okay. Now, you can also do this for your partner if they're sitting down. And if you have a massage chair, wonderful. But you don't have to have that. They can just be sitting in the chair without a back on it. But you do the exact same thing. You do the neck, base of the neck, up and
I
forward.
like to put the pillow on it.
Base of the neck, up and down. For a little while, you can gently go back and forth. Pressure point here, there. And then you can move it a little bit. If you want, you go past the shoulder blade edge and you go to the fleshy part right here. Do that. Just watch out about the edges of the shoulder blade and the bony part of the shoulder. So repeat the same thing over here. Hope you can see that. There. And then, again, bone, fleshy part of the shoulder blade. Right there. Then, yeah, for people, for the shoulder blades, her shoulder blades are now pretty wide apart because her arms are forward. If her arms were back, they'd be closer. So in this case, you can just go straight down and it misses it. And you get more leeway with the shoulder blades when the person's sitting up too, because like if you move your arms back real far this way, you see the shoulder blades are close now. But now if you move your arms forward, they're up to here. So if you can, just go up and down. That okay, sweet friends? Make sure again to ask your partner regularly.
That's very, really.
A lot of times, men and women complain about this, but women, it seems more. They'll get a lot of tension here and in this spot right between the shoulder blades. But
and that is like a lot of typing using the mouse.
Then just go down.
Type right there.
And you can notice if, sorry, if you feel.
Sometimes if there's a knot, you know, it'll tickle.
Yeah, you're a little bit more tight right there. You can feel the difference in the tension. But just go up and down. Again, with the spine in the middle, you avoid the spine.
And that, you know, a knot like that can work itself out, but if it stays like that, it can, in the long run, cause problems with the spine.
So where she's got the tighter spot, just hold it there for a little while. Then work your way down. You can do the sides. It's hard to do much lower with the person seated, but a lot of times tension in the muscles on the legs and the sides pulling can cause things to get out of alignment here, and we don't realize it's a tension here, but it then will cause pain here and all over the place. But that's a general overview. Thank you. Of the techniques.
Again, it's live.
Yeah.
Oh,
I guess we can just stand here.
Totally relaxing.
Yes. So if you have any questions, please feel free to post them to us.
And thank you for joining us. And please subscribe and like and share our video.
Yes. So again, quick summary. This is not medical advice, and if you do have any kind of joint issues, back issues, anything of that nature, please do talk to your doctor or your chiropractor first about it. Make sure that they're okay with it. But the high unit is just a really nice way to relax the muscles, increase circulation, and help balance things out naturally. So again, thank you so much. And Angela, that's a great question. Again, I always say talk to your chiropractor or your doctor if you have any concern, and use common sense with that. But usually if you just relax the muscles, it's a good thing. But I always like to err on the caution side for safety. But thank you so much. We will cover other techniques, and I'm going to get this edited and distilled down.
And if there are techniques that you would like to see covered in upcoming live shows, please let us know. Add it in remarks. We have gotten requests for, you know, how we use it to build muscle And I know I've been using it and feel stronger.
Yes. So yeah, it really has. But thank you again, and you guys
Yes.
have a wonderful rest of your weekend. And feel free to email us or ask any questions, that way. But thank you, and you guys
And
have.
we appreciate you. Have a
Yes,
wonderful week.
yes, we do. Take care.
Take care.
And now I will